Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie,
And my name is Sara.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
Audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi and welcome everyone. So today no music, nothing fancy. It's but not something that we would shy away from not talking about because we know how important it is to talk about these things. And we felt that although we had an episode prepared for this week, and please, we're so sorry to our guests who worked with us last week. We felt that it would be remiss if we didn't talk about the elephant in the room and if we didn't talk about what's happened this entire week.
Mm-hmm.
What I'd like to start off by saying first and foremost, if the family of Stephanie Van Ewen is listening, our heartfelt condolences. This is not something anybody in any life could prepare for, and I think all I can say is I'm so sorry for your loss.
Mm-hmm. And I think that something that we want to emphasize is that mental health is super important because it's just something that isn't talked about enough. We want to normalize it. We want to talk about the issues that nurses face and just all the challenges that have come with the pandemic starting from last year, starting from 2020.
And I think that it's burnout and mental health stress and depression and anxiety, these things in terms of it being in nursing or understanding the background of nursing, like this stuff isn't actually new, but I feel like COVID has really propelled people into a completely different state in terms of how best can we cope during this time, because it's unprecedented, right? Like, I mean, I haven't lived through a global pandemic before. I don't think this is something that, anybody has really experienced it. So we're all kind of walking through the dark trying to figure out. But I mean, if you're already in a dark place, I feel like this pandemic has only probably shed more light onto the fact that we need to continue the conversation about mental health.
Yeah, and I just want to also say that I acknowledge that everybody is going through significant challenges, not just nurses, but what we can speak about is our own experience and what we know about what nurses are experiencing. And I think that nurses are in a unique situation because we're experiencing stress from all different places. And just even thinking about why I became a nurse because I wanted to help people. And in going through nursing school and training at the hospital, it's always emphasized that you look after other people, but it's never talked about how you can look after yourself. And we know with the analogy of the oxygen mask, right? When the plane's going down, you need to put your oxygen mask on first before you are able to help others. And so that's why I think it's really important that we talk about mental health, because we really want to talk about prevention strategies, but also if you are feeling overwhelmed, that it's okay to ask for help. It's not a sign of weakness. It doesn't mean anything is wrong with you. It's just that we haven't really brought this to light very often.
Absolutely. And I think today we will share with you our own experiences, and really we really hope that, you know, if you are struggling, if you are not feeling okay, first and foremost, it's okay to not be okay. You're not alone, and there are supports and people that are willing to help you. And if there are additional steps that you need to take, I believe at the end of the episode we'll probably say what links you can reach out to, and we'll also post it on our website as well.
So, what is the pulse? What is happening right now with nurses? How are they feeling?
I mean, just with talking to some of my colleagues and some of my friends, I think the pulse is like people are so sad. Um, they're overwhelmed. I've had nurses talking to me about, like, that they've been crying all the time. Nurses telling me that with the pandemic, maybe one of their spouses are working during the day, they're working night shifts, but because their kids are at home, they have to stay up as well to look after the kids. So it's just like one thing on top of another. It's like a compounding effect. And just, I feel like nurses are really at this kind of tipping point where I really hope that if you are struggling that you get the help that you need. But I've been hearing a lot that there are a lot of nurses that are struggling today.
And I think even the beginning of the pandemic, we never expected it to go on for as long as it has. And every time
Right.
it seems like there's a little break, like maybe the numbers are getting lower, then something happens and they shoot back up again. Or,
Right.
we heard about the vaccine coming. It's supposed to be the light at the end of the tunnel. It has taken a lot longer than any one of us expected for people to get vaccinated. That's a whole other issue in itself. But it just seems like the light at the end of the tunnel keeps getting farther away. And
Right.
and even in healthcare, we talk about when things are chronic. Chronic means anything longer than 6 months. Well, this has been double that amount of time so far.
Mhm.
And I read something at the beginning of the pandemic that this was going to last 18 to 24 months. And I could have laughed in your face when I first read it. But here we are, 13 months, well, a year later. And I really think that might be the case. But that doesn't help anything, right? That just means that we've got another X number of months to go. And I know some nurses are just taking it day by day. They can't think even a week ahead because it's like, how can I physically and mentally get through my shift? And
Yeah.
once I do that, then how do I find the energy and the strength to do this all over again?
I think back to when we actually first started with the podcast, and then like COVID hit and we were talking about COVID and just like, hopefully it won't be this long. And, like, not that we were jokey about it, but just that we were like, we just have to do these couple things, keep your social distance, mask up, and, we'll be clear of this. And like you said, we're well into the shit. Like, we're well deep into this. And I think everyone's feeling it, but there are some that are feeling it 10 times more because there are other compounding issues. And those are the people that we need to not just say, "Hey, how are you doing today? Like, what's up?" It's actually asking more questions, probing further, and really asking things that might be difficult. If you're seeing, and I think we'll probably talk a little bit about, like, what are some of the signs that you might see of someone who is burning out. And I know we've talked about this before, but I think it'll be good to just touch on it again as well.
How about we kind of go into like why did we start this podcast? Because there are many different reasons why we started it. Mental health was one of them for sure. We wanted to address issues such as bullying. We wanted to talk about mental health, also diversity and gender equality. But mainly, it was just an experience that you and I had where we were bullied in a previous place of employment, and it really led to a lot of mental health issues. And then I started to understand some of the struggles that people face in order to get help, but also to be off work. And there was a lot of struggles, and it really just brought to light to me that the system is not set up to support people that have mental health issues. And it's hard enough for nurses, for mothers, for women to admit that they're not doing well and seek help. And then when you do so, when you reach out to your doctor or whoever and they agree with you, they validate what you're saying, and then you have to go back to your place of employment and let them know what's happened. And when the first thing they say to you is stress is not a reason to be off work, it's like
Yeah.
a slap in the face. I felt anger. I felt so many different emotions. But now that I've had time to reflect on it, I'm thinking, like, why did that have to happen to me? And if it happened to me, how many other hundreds or thousands of people has this happened to as well? I think there's so much that could change. And I know you've had your own experience too, but we really feel like this is the time to talk about this and advocate for, more supports.
Yeah, like, kind of circling back to just my own experience, right? Like, I mean, I remember actually, I think my first whole issue, or when I started first noticing that I had some issues with mental health, well, I guess mental health stress, was actually in nursing school. So, like, pulling it really back into perspective, and I actually remember my very first anxiety attack, and I'll never forget it. it was in year 2 of nursing, and it was during we had to write, oh my gosh. Do you remember like dosage calculations?
Do I? And do I remember drip rate?
Yeah, so it was a dosage calculation test, and they had set so it was like something like 10 questions, but you had to get 80% and you couldn't use a calculator.
Oh my
Well,
god.
math wasn't always my strong suit. It never has been. But the thing is, like, I had been doing them before and not having any difficulty. And I remember sitting down and we were actually like we were writing this test in like it was so weird. I think we were like in like an auditorium of the hospital or something because we were writing it during clinical. And I remember like I'm sitting there, like I look at the test, I'm sweating a little bit now. I'm looking at the test. I start writing down the first answer and I'm second guessing myself. And now I'm like really sweating and I'm getting hot. I'm like, oh man, I'm looking around. People are like, people are going up, they're handing in their test. I'm like, oh my God. Like I look at my watch, I'm like, it's only been 5 minutes. People are so fast. And I look down and I see like sweat dripping down onto my test.
Oh
I'm like,
no.
what the hell is happening to me? And as more people are getting up, I could just feel my chest getting so tight. And I was like, "Oh my god, okay, like what the hell is happening?" So I look, I've now only actually answered 2 questions. We're like 15 minutes in and I'm feeling like I'm going to faint. So I somehow stumble up. I like get up and I kind of like walk over to my clinical teacher and I like almost faint in her arms. And she was just like, "What? Like, what's happening? Are you like hypoglycemic?" And I was just like, I can't take it anymore. Like, I feel like my chest, like, I felt like I was gonna have a heart attack." And she took me to a quiet room. Of course, I was completely humiliated because like all these other like 12 other clinical students are like, "What's her problem? We like wrote this test in like 5 minutes and it's super easy."
Yeah.
My clinical teacher took me to like a dark room. I sat there in the dark and just to try to get like my heart rate down. And they called Jordan and my mom to come pick me up. And that was my first instance with dealing with anxiety. And I didn't even know that that's what it was. Like this is how messed up it is. Like I remember talking to my mom being like, "What happened?" And she's like, "Don't worry about it, baby. Like, these things happen." And I think this is also just like a cultural thing. And not to knock my mom or whatever, because I think at the time she probably didn't really understand what happened, but like culturally, we just don't really talk about mental health. We don't really talk about like I guess there's so much stigma surrounding it. It's just like you need to be a strong, proud black woman. If you can't do this, you're weak. And we don't have weak people here. And it's not that anybody actually said that. It was just kind of like the persona that I guess some of these other figures I saw in my life that I was raised around, like that I saw. So I kind of felt, I guess, within that moment that I was crippled. I felt like, oh my God, like no one else, this never happened to anybody else. Like I remember hearing my parents like they'd be like, oh, no, like they wouldn't talk about people in our family having mental illness, but they might have been like, oh, this person went to the madhouse, or kind of like these kind of like
Yeah.
derogatory type
Yeah.
terms, right?
Yeah.
And I remember just being like, how do I explain that this is like what happened? Like, and it was very interesting because when I like fully explained to my mom, she's like, "It's fine." And I was like, "What?" I was just like, "What's happening?" And she's like, "It's fine. Like, people have stress, people have anxiety, and whatever you need, I'm gonna be here to walk you through it." And it's just like, oh, damn. Like I thought like it was gonna be a problem, but it was just the fact that even I had my own preconceived notions of what it was like to be, the strong person, strong personality, and knowing that all of that is a huge facade. It's so much bravado and so much bullshit and just so much nonsense. And I think that's also a part of it, right? We need to cut out all of that. So that was kind of like my first experience, but it kind of just obviously with having anxiety, it will follow you. So
So when did you realize that you had had a panic attack? Because I know you said at the time you didn't know what happened to you.
I think I realized afterwards because I ended up having more panic attacks. So like that was like the
Mhm.
first of a variety of series of having panic attacks. And then like actually after I actually got into a really bad car accident that created more anxiety because I used to be afraid of driving in poor weather, all of these different things. So I actually ended up having a lot of while I was getting physical therapy because I had injuries, I also was getting a lot of mental therapy because I was scared to get into a car. I didn't think I'd be able to drive again after having this really bad accident.
Mhm.
It just kind of leads me, like, I felt that even after all of that period of time, that I was able to manage it, right? I was able to do my breathing exercise. I was able to, like, I never really had any more panic attacks after that until
So, like, would you say a few years went by where you were fine, like, you weren't having panic attacks at all?
many years, Sarah. Like, it
Yeah.
was, well, God, that's like what, 10, oh God, how long have I been a nurse for? Like a long time, over 10 years. If I had the anxiety come up, I would be able to manage it. It was never anything that I felt that, I had to go back on medication for. Cause at that time I was taking Ativan. I was on some other medications as well.
Right,
But,
right.
like, it was fine. I think it started with the bullying, with the gaslighting. That was like the worst, right? The, like, the am I going crazy? Is this person really like doing this to me? Like, am I being like messed with here?
Mhm.
And then it was also the bullying and the harassment. And I think that was the part that kind of took me aback, because I we are taught as nurses to confront the people who are causing us these transgressions. And not only are we supposed to be able to confront them, but the conversation after that should be one of mutual respect. And that is definitely not what happened. It only made the situation worse. So a lot of people actually will say, like, oh, if there's a problem, come to me. If you have concerns with the way I handle something, come to me and talk to me. Well, this is where I talk about, like, we'll have to have another episode, but this is where you talk about learning how to play the game. But I actually genuinely thought this person was looking out for my best interests. And I actually went to them and said, hey, you actually have been yelling at me, treating me very disrespectful in meetings, gaslighting me. And the person admitted it. They're just like, yeah, I have been doing that. And I was kind of like, oh, okay. And they're like, well, this is why. And I was like, whoa, there's like a full on explanation. Not even like, this is unacceptable, I shouldn't be doing this. Just like, I was doing this because I didn't like this, and that. And I was like, okay, there was never any issues before, but now there are issues. So I was like, am I being performance managed? No, I wasn't. But just the fact that, they wanted to see different results. So I guess bullying a person to see different results was maybe this person's pathway.
Mhm, and I remember just from my perspective, I feel like your personality changed a little bit where you started to be very nervous, and I'm like, us doing this podcast, you are not a nervous person at all, but you started being really nervous when you were around this person just in your interactions with her. So I did notice that. And I'm like, I started feeling nervous for you, to be honest, because I didn't want you to say anything that would be perceived as incorrect or a mistake or, talking too much or not
Yeah,
talking
I
enough.
remember.
I started to feel anxious for you, but I didn't
I
know
remember
how
being
bad it
like,
was.
Sarah, can you check my work? Like, am I going crazy? Can you reread? Like, it was bizarre. Anyhow,
Yeah.
it came to the point where I was so crippled from the bullying, from the harassment, from the intimidation, from the gaslighting, that my mental health stress and crisis fully came back from the same time when I was back into, this year 2 nursing situation, but like doubled, tripled, right? Because there were other things coupling it, feeling inadequate, being made to feel belittled and stupid. And I just remember being like, I think it came to the point where I was like hiding under my desk and I was like turning off the lights in the office and like hearing her. I'm like, oh my God, I just need to hide. That I was like, okay, this is not right. And I shouldn't have to deal with it like this. And to make a long story short, because we have an episode where we've done this, we've talked about this a lot. Um, we got to the point where we moved on from our careers, but we do need to talk about the whole mental health support or lack thereof, right? I think this is where we really need to turn a page onto how do we make this better for people? How do we make a situation like me not occur, like you not occur, like someone else who's dealing with depression and anxiety and stress? How do we stop that from occurring? Because, we talk about preventative medicine all the time. Mental health is health. There's no way around it. But the stigma is so overwhelming. And you think that, a hospital is supposed to be a caring environment. Absolutely, it should be. And for the most part, I do see a lot of really great things that happen there, but there's some really effed up stuff when it comes to mental health and dealing with mental health stress of employees.
Absolutely. And I think nurses are just so afraid to talk about it. We're so afraid to talk about so many things, and there are various different reasons around it. But the main thing is there's the shame, there's the guilt, there's the feeling of inadequacy, then there's a feeling of retribution. Like, am I going to get in trouble for talking about this? Am I going to
Yeah.
get fired? That's a really common concern to have. And we just really want to emphasize that it's okay to talk about what's happened. And, Amie and I, we feel like we want to advocate for those that don't have a voice or don't feel like they have a voice. So, in terms of what we're asking for, maybe we could even touch a little bit upon that too.
Yeah, before we get into the like what are our asks and what are the things that we see that can be changed, let's talk just quickly about what does it actually look like? What does mental health stress or burnout look like? Because some people, like, if they're in it too deep, they can't even recognize. Or if you're the person, the friend, the colleague, the spouse, how do you see some of the symptoms? There are some small things that you might see that might be some telltale signs, but at least it might get the conversation going.
I think some of the things, they're very vague, right? So they're not like, oh, I have this symptom, I must be depressed or I must have anxiety, but just little things like not being able to sleep. So I know there's very different reasons for not being able to sleep, but like when there's an environment to where you should be able to fall asleep and you just can't shut your mind off because you're so anxious, you're so worried about whatever it is that's bothering you, that you can't sleep. So that's affecting your quality of life, right? If you have a sudden change in appetite where you're not feeling like eating at all, or you're eating a lot more than you normally would, that's another sort of red flag that I think you should look out for. In my case, when I was having a lot of anxiety, I was having serious bowel issues. And maybe this is too much information for some people. No, I was like, seriously, I was having diarrhea, and it's not because I was eating things that were making me sick. I was so anxious about work that I was having diarrhea like multiple times a day. And I'm like, this is not normal.
Right.
And I kept trying to justify it with different explanations. But when I was removed from that situation, I realized it was all the stress I was under. So just having like digestive issues, I think, is one. Um, Being overly irritable. So things that normally wouldn't bother you really bother you. You're snapping at people. Little things set you off, or you're becoming really forgetful. So I remember saying to someone
Oh
that
yeah.
I
Jeez.
had no short term memory, like anything and I would be missing my exit on the highway, like things that I did every day. I'd be so preoccupied with what I was dealing with that I would be missing the exit to and from work. That's not
Yeah.
normal. And I think also I mean, some people have more subtle signs. Some people are better at hiding it than others. But I think
Right.
those that are
Right.
close to you would be the first to sense that something is off.
I can only speak from my own experience, but like some of the same things that you said, the joy of doing things was the kicker for me. So I was a avid exerciser. I used to like, I'd jump on my bike, I'd be lifting my weights. I did not want to do anything. Like I wanted to do the bare minimum. Like I wanted to come home and I wanted to sleep. So for me, the sleep was the biggest thing. I would come in and was so exhausted that I would sleep. My husband would be waking me up and he's like, "You literally came in and slept until like 9 o'clock. Now it's like bedtime." And then I'd be up all night because I just slept all day, right? Or I slept as soon as I came in from work. And that was kind of one of the signs for him that he's like, something is not okay. Um, the other thing for me was eating. So like I should be on a regular day about like 145, but like I gained quite a bit of weight. So that was through, just I just didn't have the desire to, prep my food or do any of that stuff. So lots of eating out, lots of
I
binge
remember us,
eating and
like,
just oh my god, the
we
money you
spent so
spend
much
doing that.
money at the cafeteria, and honestly, part of it was just lack of time because of the
Yep.
crushing workload, right? Like, when you have 5, 10, 15 minutes in between meetings, you're like, "Well, I'm just gonna grab something quick," right? And then get on with it. So I think that's part of it too.
Yeah, and I think like I said, for me, I think the biggest thing was I just didn't feel joy. I didn't feel happy in anything that I was doing. It's just like there was nothing that could motivate me to feel happiness. Like, I know that sounds really sad, but it's just, I just didn't want to do anything. Like, my kids would come in and you think that, they should be like, they're the ones, right? Or, my spouse. And it was just, there was nothing. And I hit a point where I actually remember being at work and I was like, I actually feel quite like, I feel like I might commit suicide. And
Oh
they
my
actually
gosh.
put me in an office all by myself, knowing that I had such severe mental health. I was just starting treatment, and they left me alone in this office. And I remember actually reaching out to the director at the time because I was crying. I actually found the I guess it would have been the one of the educators at the time, and they were just like, "We're so sorry. We're just not equipped for this." And I was just like, "Yeah, no shit. Like, you clearly have no idea how to deal with someone." And it was the pressure to be back at work. I remember them like, "Oh, we'll accommodate you. Just come back to work." And it's like, but I'm not physically right to be here. Like, my mind is not physically right to be here. But so we could talk about all the bad stuff, right? We could talk about all the stuff that they're not doing well. Let's talk about how organizations, hospitals, large organizations do better, because they need all of them. All of them need to do better.
Yep. I think it really just starts from the top, right? So when organizations are when they are dealing with new employees, right? I think it's really important to talk about mental health on an ongoing basis. So not just when something happens, which happened recently, right? It's like this should be
Mhm.
a part of the culture. When there's let's say there's a code that doesn't go well, there's a patient that's passed away, there's a really difficult situation, it should be part of the culture to talk about it and routinely let people know what resources are available. And I think the other part is the resources that are available need to be made a little bit better. So in terms of our extended health benefits, let's say, I know from personal experience that the amount that you're allotted for mental health, so let's say counseling or psychotherapy, is $500. Anybody that's been through the system knows that might get you 2 sessions, which is
Yeah.
really not enough to do anything at all. And then you're either not doing it because you can't afford it or you're paying out of pocket. So that's one thing. Number two is that if nurses even access the employee assistance program, which I feel is quite underutilized, it doesn't give you a whole lot of sessions either. And it doesn't connect you necessarily to a mental health professional, but you might be talking to a counselor. And it's more geared towards short term issues that you might be having. It's not there for long term. So I think if we could advocate for more sessions for any sort of employee assistance program, that would be hugely beneficial.
Yeah. And just circling back to the policy and governance aspect. So, return to work policies, sick day policies, really looking at mental health as actually health. So, that whole entire process of someone coming in and saying, I like, just from the hop when you were like, the OC health person said to you, well, stress isn't a reason to be off. Like, she should have been slapped right in the face. Like, I couldn't believe when you told me that she said that to you. I
I'll
was just
never
like,
forget
what
that.
did
I'll
she
never
say?
forget that. And I'm like, I think you need at the minimum sensitivity training and to understand that what someone is going through is extremely difficult. Like in my case, I had never been off work ever in my career for any sort of
Mhm.
sick leave. That didn't matter to them. And I know it doesn't really matter in the grand scheme of things, but for me to be off work for something that I wasn't even sure was that serious, but I was told by my doctor it was, and for that to be the first words that come out of someone's mouth, just set the tone for everything that was to come afterwards. Being on stress leave was just as stressful as remaining at work for me.
Oh, absolutely. Like, when I think back on the process, I remember that first call that I received from, I believe it was actually HR, it wasn't even the occupational health department. No, or maybe it was OC health. And they're like, tell me the story right from the top. And I was like, okay, well, are you a psychologist? Like, am I speaking to the right person? Like, what is it that you need to hear? And that part was I had to tell my story like 4 or 5 times. No continuity of care. It was it was humiliating. And I remember when they're like, "Oh, we're going to send you a form, take it to your doctor to fill it out." And I remember looking at the form. I wish I kept it. All functional. all physical. So, like, can you lift a box? Can you weight bear? Can you do this? Well, it's my brain that's broken, not my bloody leg.
Hmm.
So, the forms need to be completely overhauled to really understand and capture mental health stress. You can't give a functional physical limitations form and ask someone with mental health stress to fill it out. I brought it to my doctor and she's like, "What is?" She's like, she made her own little package in terms of what to write because she's like, "This is not adequate." And I was like, "I know." And and I remember just the hoops that you had to jump through. It was unreal. And I understand that the counter argument would be, "Oh, there are some people that abuse sick days or sick time." I really believe that that might be few and far in between. I'm pretty sure it's easy to identify someone who is going through a mental health crisis versus someone who just needs the time off. And maybe if people had proper sick days and sick day allocation policies, that people wouldn't abuse the system to begin with.
Right. And I think also it's just like what is the main issue here? We're worried about people taking advantage of the policies and being off maybe longer than they should. But we know in nursing culture there's this whole issue around even calling in sick because
Right.
we feel like guilty. We feel like we're letting our team down, we're letting our patients down, we're letting everybody down. So I like to say that there's a culture of not calling in sick even when we're not feeling physically or mentally fit to be at work. And just even to talk about the whole mental health, like being off for mental health, I remember in occupational health, they they called me a quote unquote a special case, and I was passed to the manager to deal with me because I guess nobody had ever like been off for that reason before, or maybe they just called it something else. I thought
No,
like
they called me a special case too, which made me feel even more
I
special,
felt
right?
like
Like,
a
I
freak.
mean,
I'm like, what do you mean I'm a special case? Like, is it that bad that I'm feeling like I'm having mental health issues and I need to be off? Like, talk about not normalizing the situation.
Sarah, I fully remember the person speaking to me and being like, honestly, that whole experience. I remember her saying, what was it that she said to me? Like, yes, she called me a special case, and then she's just like, "Oh, oh yeah." She's like, "We don't actually see this very frequently." And I was like, "Okay, come on, are you kidding me? Like, I'm the very first person that has had mental health stress and crisis coming to you. Like, give me a friggin' break. I can't be the first, and I definitely am not going to be the last." Let's move on to talking about EAP. So we touched on it a little bit, but I'd like to say that one, it's a short term solution. And really, the providers are limited by their scope. So you may get anywhere between 3 to 4 sessions and then it's cut off. Like, when I mean cut off, it's like it ends abruptly, and they don't have diagnostic ability. So if you do need to see a psychologist or a psychiatrist to diagnose you, you do your sessions with them. You tell your story all over. You do your first prelim, you do your second, so you do your entry, you do your then the next session is you actually talk about your problem. Then the next section you might be getting into a little bit of therapy. Then the fourth session is like, yeah, we're done with you. Employee assistance programs are very short term solutions. They are what I would say the band aid to actually what people truly need when it comes to mental health stress. So let's talk about coverage and benefits. So I just pulled this up and it's going to blow your mind, Sarah, because I thought it was $1,000 coverage. It's more. So, most organizations that I have ever worked for have given some type of an allocation to mental health benefits. So that would be, going to see a psychologist, and of course, there are parameters under who you can and can't see. That's a whole other issue in itself. But they have been very, very meager. $500 or less, which will get you maybe 1 to 2 sessions, and then the rest is out of pocket. Starbucks Canada has launched an unprecedented 5,000 per year mental health benefit for all eligible employees who work a minimum of 20 hours a week. So you're telling me a barista, thank you because I love my Starbucks, by the way, gets $5,000 per year, and we get as healthcare workers and nurses like 500
We're talking
max,
about a
maybe. Like, what
tenfold
are we
increase.
talking about?
This
Like,
is
what
not
the
like
friggin' hell?
this is a tenfold increase. You do realize that, right? And we're talking
This
about
is why I'm dying inside. Like, this is insane.
Shout out to Starbucks Canada. This is amazing. I think
Call us,
that they're
call
really
us.
taking the lead in this.
But anyways, like just really like that, I think just as a standalone, we need to standardize as a start to increase those benefits. $500 is a pittance. Pittance. Come on. You know you're giving us peanuts. You know it's not going to get us far. How many hundreds of dollars have I and other people that I know who are off on mental health stress or mental health leave have been spending hundreds and hundreds of dollars getting treatment out of pocket? Do we expect you to pay, like in Canada, do we expect you to pay for your leg surgery out of pocket? No. OHIP covers it, but OHIP doesn't cover mental health.
Right. So just to clarify, I think what we're trying to say is most mental health services are not covered. If you get to the point where you need a psychiatrist and you're actually able to access a psychiatrist, then that's covered. If you get to the point where you need to be hospitalized for mental health issues, that's covered. So we're talking about end of the line, right? What
Right.
about all of the preventative steps that could be taken to avoid a situation like that? None of that is covered, and I feel like the supply versus demand in terms of psychiatrists is very lopsided. So in my situation, I was told that I couldn't be paid to be off work if I didn't have a diagnosis. Well, in order to get a diagnosis, you have to see a psychiatrist. And in order to see a psychiatrist, we're talking about a 3 to 4 month wait if you're
Oh,
lucky.
it's way more than
It
that
might
now,
even be
Sarah.
longer than that. So it's just like setting up all these barriers to prevent people from accessing the care that they need is counterproductive. And
Yeah.
when we're talking about the bottom line, so let's say the hospitals are thinking in terms of finances, right? A lot of hospitals are in the millions of dollars for sick time for nurses, and they keep wondering why that is or how they can improve it. Well, I think we're talking about something that makes a lot of sense here. If we can prevent these issues, then nurses may not feel like they need to call in sick, or they may not quit their job because they can't deal with the stress, and maybe they never thought to go on a mental stress leave. They just end up quitting and leaving altogether.
Yeah. I mean, I think this is where I guess our last ask would come into, we need a national strategy here, right? Mental health is health. No one should have to suffer through a mental health crisis worrying about whether, like, this is the concern, right? Do I have enough money to continue getting the mental health treatment that I actually need in terms of the therapy, in terms of the medications, in terms of whatever else support that I need? Do I have the money to do that out of pocket, or do I have to say I can actually only afford 3 or 4 more sessions and then that's it? Because it happened to me. I remember, like, my psychologist was amazing. Amazing. But I had to, like, it came to a point where I was like, okay, I've got a $2,000 tax bill and I've just raked up like $5,000 just on like 1 month of therapy. And it's like I made the decision to say, well, I'm going to take the tools that she's given me and I'm going to see what I can do with them at home. And at least I had other supports in place, but not everybody has it. And I still was forced to make a decision, a choice to not continue with treatment because I couldn't afford it. Because I couldn't afford it. And I'm not hard up. Like, I'm not saying I don't, I make great money, but like I had a decent income, but it was like there was no way that I would have been able to, because one, obviously now if you're off on mental health stress, your income is severely reduced because you don't get 100% of your income on short term or whatever. And it came to the point where it's like I have to choose to not seek out help and service because I can't afford it.
Right.
I hope other people hearing can see how that's hugely problematic. Like, I don't think someone who was seeking out care for cancer or heart disease or something like that, and then just being like, oh yeah, by the way, sorry, you've actually run out of benefits, or you actually need to like mortgage your house to get the care you need. Oh yeah, we're not in America, but when it comes to mental health, we might as well be.
And let's not forget all of the casual and part-time nurses that don't even have extended benefits. They don't even
Jeez.
have the $500 that we're talking about. So they're really starting from nothing. And You know, if they have to take time off work for a casual nurse, for a part-time nurse, you're not getting paid. So it's a double loss of income there if you're actually taking time off to deal with your mental health issues.
Yeah, it's we need a national strategy that deals with mental health as preventative medicine. We have to do something different here. We can't keep putting mental health to the bottom of the barrel because we do know how gravely important it is for people to have the right supports in place, because we know that one loss cripples many people. We can't keep doing this.
Hmm.
Where do we go from here? So this is the like $50 million question, right? I mean,
I think that's a really good question. I think even just us talking about it in the media, I think it's just starting the conversations, and the more people that join in, the more we can put our heads together and put pressure on the government and the decision makers to really change policy and make things better for everyone.
yeah, I feel like this advocacy work is so hugely important to myself and Sarah. Like we've thought about like what are the next steps for the Gritty Nurse podcast? What other things can we do to continue to elevate conversations surrounding mental health, surrounding women's health, surrounding anti-black racism, surrounding women's rights and women's health? Like what is the next natural step? And we really hope that people will reach out to us, whether it's organizations, whether it's people wanting us to come and speak. Like we're happy to share our experiences and our stories with people. I mean, I think we just want to be able to be that voice and to really help in any way that we can. And of course, be political activists. Nurses are activists, whether people want to believe it or not. They're, I'd say, for the most part, nurses are silent activists, but we won't stop. We're going to continue to push these agendas. We're going to continue talking about these things that matter to us, and we're not going to back down.
And I just want to end by saying that if you are feeling like you have mental health issues right now, you're feeling stressed, you're feeling overwhelmed, please talk to someone. If you feel like you are going to harm yourself, please know that you're not alone, and there is help out there. And make sure that you get the help you need. And if this is someone that you know, please reach out to them and talk to them and offer your support.
Yep, absolutely. Please get the help that you need. And I keep on saying it. I know it's cliche. It's okay to not be okay. And I don't think we touched on things that we can do, but here's a quick little tip from myself, and maybe Sarah, you can share something for yourself. So one of the things that helped me and got me a little bit more mentally prepared and mentally healthy was kind of two things. So I do have some really great people that I surround myself with, and this podcast is an outlet for speaking my mind and speaking freely and not feeling silence, because that was a huge thing for us as well. But I know this sounds crazy. I haven't been able to do it as frequently as I'd like to. Brazilian jiu-jitsu. Do you remember those stories, Sarah?
There's so many stories around that, and I worry about your injuries, but I'm glad that it's helped your mental
It
health.
was it was like it was exactly what I needed. I just needed to feel that pressure, the like I don't know, something about mixed martial arts, specifically Brazilian jiu-jitsu for me. I don't know. Just I think the empowerment, it felt that it gave me back power, because it's a sport where it's not about the size of your opponent but the wit. And it's like they liken it to a game of chess. So I just found power through doing it, and finding a sense of community with my BJJ team. So I really hope that after the pandemic finishes up, that I will hit that harder than I hit it earlier in the year. And then my other thing is shamelessly watching Netflix. And I just finished Bridgerton. I know it's super lame, but I loved it. It was just like a dystopian or utopian world that I threw myself into, and now I'm into Schitt's Creek. So you
Awesome.
got to do what you got to do.
I think
What things are you
everybody
do to keep yourself healthy now, Sarah?
Well, prior to the pandemic, I used to do a lot of yoga and Pilates. I know I've talked about that a lot, but it was really sort of my way of de-stressing and relaxing and, getting in some exercise. So I found some great YouTube channels that I use now. There's one called Moving Mango, and they do a different Pilates workout every day, which I like. And then I know this sounds really lame, but this podcast has really helped me mentally because
Yes,
I
yes.
felt so silenced and I felt so powerless by the end of my experience that I really needed an outlet to do this. And, thank you, Amie, for coming up with this idea and bringing me along on this journey because it's really opened my eyes to the fact that a lot of people are experiencing what we have. And we've built sort of a nursing community around this podcast where you and I have talked about like all the people we've met on our journey. We want to do like the Gritty Nurse podcast tour across North America and
Yep.
visit all the people that we've met virtually and really just, like connect with them on a deeper level. So I think for me, that's been hugely empowering. And my wish is that more nurses would be more active, right, in these sort of issues. And we're happy to connect with people that, want to start on this journey too, whether that be podcasting or a different sort of way. But that's been helpful for me.
Yeah, I think Sarah and you I know you air the sentiment. I think if we were able to think big and we were to dream that we could have like a Gritty Nurse Foundation, we were speaking to people, we were connecting people, we were helping people with mental health, informing policy, making changes. That would be our huge, huge dream. But again, like we said, it's a dream. So we'll see. We'll see what's next for the Gritty Nurse podcast. All we know is we love what we're doing. It's passionate, and we're always going to bring you the grit.
Thanks for listening, everyone.